Hello, my name is Felicia Gavins. This is week 6, my final presentation for A6-16 Healthcare Management Information Systems. Please disregard the background noise as my roof is being done, and I have nowhere else to do this assignment. Thank you. So, ABC Dermatology Healthcare is an 8-physician dermatology practice. The CEO of the practice is Dan Brown, and he does not have much knowledge of electronic health records. Through gossip, he was convinced that electronic health records were not reliable and not a good thing for practices. But he is willing to learn now and choose and implement the best option for his practice. ABC Dermatology Healthcare is seeking an integrated software application for the entire organization that includes an electronic health record, scheduling, billing, and e-scribing capabilities. Risk analysis strategies on how applicable laws and standards meet organizational needs include the following. We can start by making sure that the office chooses an electronic health record that will be HIPAA compliant and support all of the rules and standards. The organization can use the National Institute of Standards and Technology's toolkit, which helps providers and their companies improve their understanding of HIPAA rules, standards, and regulations. This toolkit implements those needs of the organization and evaluate those implementations in the company's workflow. The toolkit objectives are to focus on any entities that use HIPAA locally as well as nationwide. The Office of National Coordinator for Health Information Technology and the Health and Human Services Office for Civil Rights have together created a HIPAA security risk assessment tool. The tool's structure make it useful in supporting small and medium-sized healthcare facilities fulfilling the Health Insurance Portability and Accountability Act security role. Components of healthcare decision-making models emphasizing the system development life cycle, which includes planning, selecting, implementing, evaluating the healthcare information system. ABC Dermatology Healthcare practice must go through a systems development life cycle. The essential components of healthcare decision-making models are preparation, choosing, applying, and assessing healthcare information. All parts of these components help in bettering a practice by implementing something new. The key players are Dan, the CEO of the office, physicians, coordination staff, financial coordinators, and information technologists. The responsibilities and roles of the key players in strategic planning and continuous quality improvement are as follows. Dan, the CEO of the organization's responsibility is to collectively, with the rest of the key players, choose a software application that will benefit everyone's needs in the organization. Dan also is responsible for the entire process from creation to implementation to follow-up of the user information technology. The role and responsibility of physicians are to ensure that the program selection is best for them. They must ensure that the application is user-friendly and allow the most straightforward process, since some physicians are not technology savvy. The coordination staff that consists of secretaries and coordinators that have specific jobs in the practice that require them to use the program frequently. This person or people will be a part of the picking of the software application as well. And then we have the financial coordinators that will be included in the software choosing, and they will be doing the billing and involved in the revenue cycle process. Finally, the information technologists must ensure that the practice is prepared for the new system and be on standby to ensure that the implementation process goes well. The impact technology has on cultural factors in healthcare provisions and decision making are language, religion, cultural rituals. Language is one of the significant factors in healthcare that causes issues that sometimes make the patients as well as the physicians uncomfortable. In this day and age, we must all have a plan on how we handle these cases where both the office staff and the patients are heard and the patients understand their treatment plan. Religion is a significant cultural factor because some treatment plans are not allowed. For instance, Jehovah's Witnesses are not allowed to receive blood no matter what. If a freak accident happens at the dermatologist's office and during the removal of a mole or something and it begins to bleed a lot, the patient may need to go to the hospital for a transfusion but not be open to it because it's against their religion. Another factor is cultural rituals. In another way, patients may have difficulty getting the best care because women in some cultures are not allowed to speak. Some are not allowed to give eye contact, and others are not allowed to undress in front of men, even if it is a physician. These cultural factors can make it difficult to complete an assessment or treat a patient. Enterprise-wide data is a wide-ranging software bundle that supports establishments' workflow and aid in the daily workflow by helping it to work smarter and use the most simplest process. Information governance is a policy-based regulator of data to meet all legal, regulatory, risk, and business demands. Information is reserved as long as required by regulations and laws or internal businesses' needs and risk assessments. Then it is discarded according to a specific retention and disposition schedule unless there is a hold that requires an attorney, like a malpractice suit. Information technology governance is the primary way that participants can confirm that investments in information technology generate business value and contribute to meeting business purposes. Data governance contains procedures, controls, and guarantees that information at the data level is gathered and put into the system as accurate as possible and as uniquely as possible. Best practices and policies as they relate to data governance, information chains, and technology and structural interoperability. The data governance policy is documented collection of guidelines for ensuring the proper management of an organization's digital information, such as instructions, can involve strategies for business process management and expertise risk planning, as well as security, data quality, and privacy. The best practices and policies that relate to health information exchange are many influences. These influences establish opportunities for the staff. The influences consist of allocating staff training and responsibility and must be a part of continuous learning and compliance program required by management or leadership. The goal of best practice is to increase competence and accomplish anticipated service supply. This shows that IT doesn't just work on the back end, but treat it as a service provider or a team player. Structural interoperability are standards that are outlined within the Office of the National Coordinator for Health Information Technology and was designed to organize input from the community and isolated subdivisions to generate synchronized health information technology qualifications for use all over the United States. The advantage of system acquisition is that it will lessen many problems for the ABC dermatology practice and the patients. The facility will not have to search for charts any longer, as the information will be at arm's length for all staff members. No more waiting for physician prescriptions. Now patients can go directly to the pharmacy or have prescriptions delivered, which will make it easy for everyone. Thank you very much.